Hi, welcome back everyone to another Positive Parenting Expert Q&A video. I'm Dr. Zulkifli Ismail and today I'll be answering some questions on how to take care of your family's health when traveling.
What are the factors that can affect my family's health when traveling?
When traveling, there are many factors that can influence you and your family's health. For example, your family may be exposed to various different infectious diseases. Furthermore, the new environment may have a different altitude, humidity, and temperature, which can affect the body's ability to fight off infections. So it's important to understand the health risks associated with your chosen travel destination and to take the right steps in preventing them when traveling. Preventive measures can include vaccination, medication, hygiene practices, and more. These can help minimize the risk of catching a disease during your travels.
What travel vaccinations should I get for my family?
The destination you choose will determine which vaccinations your family requires before traveling. For example, cholera, hepatitis A, or typhoid are recommended when traveling to destinations with poor hygiene and sanitation or where these diseases are endemic. Examples of such places include Haiti, Somalia, Pakistan, and a few more countries. The meningococcal vaccine is recommended for those visiting countries in the sub-Saharan African meningococcal belt like Ethiopia, Chad, and Burkina Faso. Additionally, it's also part of the requirement for those traveling to Saudi Arabia for the Hajj or Umrah pilgrimage. The yellow fever vaccine is recommended for those traveling to areas with a high risk of this disease. For example, Brazil, Nigeria, or Angola. The rabies vaccine is recommended for those who are traveling to high-risk destinations like Bali, India, or Thailand. The Japanese encephalitis vaccine is covered in our National Immunization Program for Children in Sarawak. For families who have not received this vaccine and plan to travel to an endemic area, such as Indonesia, Vietnam, or even Sarawak, it's advisable to consider taking this vaccine. For more specific information, it's best to consult with your family doctor. They can provide personalized advice based on your family's history and the specific travel itinerary.
When and where should my family get these travel vaccines?
Different vaccines have different dosages, timing requirements, and some may even require boosters. As a general rule, it's recommended to have a medical consultation at least 4 to 8 weeks before departure. If the travel is long-term, it's advisable to consult even earlier. This allows enough time for the vaccine to be administered and provide full protection. For example, influenza vaccines or flu vaccine are recommended to be taken annually and at least 2 weeks before your trip. There are also other vaccines that are mandatory to be administered at least 10 days before the arrival in the country, where travelers must submit a valid certificate of vaccination. Examples of such vaccines include meningococcal and yellow fever vaccines. With regard to where to get these vaccines, you can visit any government clinic or private clinic to set up an appointment.
What other precautions should families take when traveling?
First, pack a medical kit. This can include over-the-counter pain relievers like paracetamol, antiseptic ointments, bandages, sunscreen, insect repellent, hand sanitizer, and any prescription medications required by any family member. Second, plan for emergencies. Choose destinations where Healthcare facilities are easily reachable, and read up on your destination beforehand to note any local outbreaks. It may also be useful to carry a written copy of each family member's medical history in case of an emergency. Third, keep up to date with routine vaccines. This is especially important for young children who may not have completed their immunization schedule yet. Staying up to date on vaccination can ensure maximum protection before traveling. Fourth, practice general healthcare measures. This includes maintaining good hygiene and being cautious of certain cuisines, especially local delicacies that are not thoroughly cooked, and contaminated water sources. Finally, opting for a travel insurance plan that covers you and your family can provide financial protection in case of accidents or illnesses during the trip. By taking these precautions, families can have a safer and more enjoyable travel experience. Unfortunately, that's all the time we have today. If you would like to learn more about parenting and related topics, please visit us on the Positive Parenting website as well as our social media pages on Facebook and Instagram. Thanks so much for watching and see you next time. Bye-bye.